I'm Dr. Aditya Kailash Jain. I am a lecturer in human resource management at the Nottingham University Business School. My research interests, primarily my work in occupational safety and health is research. So this is what I do, and translate research into practice by means of writing guidance for both at the policy level and also for industry. My main area of focus is managing work organization and how that can be maximized to promote workers' health. So it comes down to the management of psychosocial issues at work. So things like work-related stress, harassment, and bullying at work are the kind of issues that I look into, and how better work organization and management can be used to improve working conditions and workers' health. Stress, if you look at the data, and depends on where you look at the data, is generally has been increasing over the years, partially because there has been also increased awareness of the issue. So workers are more aware of stress, and there are more mechanisms to report stress. So for example, there are more surveys, and there are more questions being asked about this issue. So yes, stress has been increasing, but also if you take Europe as an example, stress has been increasing, but not drastically as it was in the past 10 years or so, and that's because in the recent few years there have been a lot of initiatives that have been taken, and there are several initiatives being taken now aimed at trying to reduce the impact. It is still increasing, but the rate at which it is increasing has reduced to some extent, and I think that more work needs to be done. But if you look outside of Europe, in places where policies for managing stress and even awareness of stress is quite low, we see the increase the increase rate is very substantial, but unfortunately, the awareness is very low, and there are other issues, more traditional health and safety issues, which take more prevalence, and people don't talk about issues like stress. I think because obviously the World Congress is organized by various stakeholders, and the focus generally has not been as much on, from my perspective and my interest at least, on the more contemporary issues in relation to occupational safety and health, mostly linked to health issues and mental health issues specifically. And I would like to see more of that. I would like to see more link between safety and health, not talking about just occupational health and not just occupational safety, but the link, because they are not separate. I think we need to look at occupational safety and health more holistically. The World Health Organization has launched a framework on healthy workplaces, which talks about the physical work environment, the psychosocial work environment, health promotion, and what is corporate social responsibility in a way. And I think that kind of thinking is quite important, and I would like to see more of that in the World Congress. We see very good examples of how companies are excelling in reducing injury, reducing accidents, reducing fatalities. We also see good examples of how companies are saving costs in relation to cutting down sickness absence because they're taking care of workers, lowering occupational diseases. But I think they are interlinked. If you have a good safety record, it is likely that you might have a good occupational health record as well. And then if you have poor safety, that will have impact on workers' health as well, because you will have more perceived stress, more insecurity at work, where the workers might feel that. So that can affect their mental health. And I think we need to see more of that. We need to see the link between these different areas.